Good morning, welcome to 59 Minutes. My name is Levi Kones. This morning we are going to be discussing to do with the battle against cancer. And to join us is a lady who is a cancer warrior. She's been battling cancer of the thyroid. Join me in welcome, BONA WATAKA. Glad to have you here.
Thank you.
Yeah.
Good morning.
You have an interesting name, it's rang easily.
And you can't forget.
You can't forget
yes,
it.
you're asking a question in Swahili. You can't forget it.
Yeah.
BONA WATAKA.
So who is BONA WATAKA?
BONA WATAKA is a child of God. I turned 40 on Madaraka Day, which is amazing. Amazing and with,
Come to the fourth floor, has the best views.
It has. Thank you. It smells amazing in 4. I'm a mother of 3. I'm a teacher by profession. Yes.
You're a teacher by profession.
Yes.
So the journey with cancer started when?
So my diagnosis was in February this year, 2020. Although now I had nodules from 2019, growths in my thyroid, cysts filled with some liquid.
Yeah.
In
For you, when did you start feeling funny and think maybe something is wrong here?
In 2019. Yeah, because a friend of mine saw a lump on my right side of the throat. So we had, because my dad had lymphoma and he had
so it in
position, and he was like, you have a swelling. I'm like, what do you mean I have a swelling? I look at myself in the mirror. You know, ladies, you have to look at yourself in the mirror. So I check and I'm like, I have a lump, I have a swelling. How come I've never noticed? So I'm like, we go to see a doctor. I go to see a doctor, a GP, and a endocrinologist.
Yeah.
So
sometimes along this journey,
it's difficult to pronounce them. Like, there needs to be an easier way of saying it. It's a mouthful. So I was referred to an endocrinologist who did tests, scans, and a biopsy. So the biopsy was benign. So the doctor was like...
Which means, tell us, those of us who have no idea.
Benign means it's not cancerous. And I had therefore had nothing to worry about. That was in 2019. So the doctor told me many people live with bad thyroids. Some know about it, some don't know. You either producing more thyroxine or less. So unless I feel not breathing well, or I have problems swallowing, or I start feeling pain, I watch and wait. So I took her word for it, and that was it. Watch and wait. So 2019 went by, and you could see it's growing.
Yeah. Of course, now that you're aware, you're really...
Now, so you're really keeping tabs. Every time you look at it, you feel an itch, you look at it. Then come 2020, started
Were you Googling? Let me just ask.
Of course. But now I was Googling, because we know about the thyroid when we learn in high school, but we don't know much about it. Where is it?
Yeah.
Does it do? And you know what the glands are. And then it just said nodule cysts, which means it had some swelling with a bit of tissue in it or water, which was not cancerous. And I was happy about that after the Googling.
Yeah.
But come 2020, started having a very hoarse voice. I'm a teacher of music, so I sing a lot with my students. You're always talking. So I was having this hoarse voice, and I don't have a cold. Then Corona happened. So what I have was symptoms for Corona.
I think all of us all had that symptoms for Corona at some point, especially in the beginning.
Yeah, symptoms. They're like symptoms of Corona. That's when I started feeling a tingling on my right side, just when we were shut down, so my voice is hoarse. I have this tingling effect. I'm uncomfortable. I couldn't, the way you exercise and you're able to do this.
Yes.
So I couldn't, because I would feel there's a lump here that is hindering your hand from growing, all the way.
Yeah.
So I go back to a doctor. They take more scans, and they do a TS3 test and TS4. That's thyroxine levels, if I'm producing enough. So they're like, one of the glands is producing below, so I should see an endocrinologist again. So I got a different referral this time around. I was like, I'm not going back. Let me find a different diagnosis. So when I talked to this new doctor, he said, it's closed. He works at Kenyatta, and they've closed down unless it's an emergency because of the pandemic. It was like, when things will open up, we will get in touch. Come and see me. So yeah, we stayed the whole of 2020 still in fear of corona and all that. So 2021, we go to school when schools were opened. So we physically go to school. And we were preparing for...
And during that time in 2020,
yeah,
what's happening?
What's happening is I have this pain. It's a sort of tingling pain that comes for about 10 minutes and disappears. So, you take a painkiller and you're like, I'm okay. Painkillers are bad. They lie to you.
Yeah, temporary relief.
It doesn't take away the real cause of the problem. So, you manage it. Some days lying down flat was a bit of a problem because you feel you're running out of breath. So you'd want to be a bit raised. And then that's the time the craze of you're exercising because you're locked down, you're working from home, but you're not losing any weight. So whatever you do, you're changing your diet, you're walking, you're running, but your weight is just, it's just there. It's not coming down. In fact, it increases. Maybe you go half, then, it goes back. And my voice is really horrible. So when we go back to school in 21 and everything is opened up, my colleagues and I were practicing hymns and pieces. There was a concert coming up.
You're still attempting to sing?
Yeah. I mean, that's
hoarse voice or not?
That's what I do, because I've been to classes.
Yeah.
We do our singing, we do our what. After the classes, I'm so exhausted. And everyone would say, what's going on with you? Why are you so tired? I'm like, I have no idea. We've just opened, so I shouldn't be exhausted. But by the end of the day, my voice is gone completely. Like, I'm not speaking as normal. So you're like, this is not right. So my colleagues and I say, let's try out this hymn. Hallelujah, we've sung it for so long, everyone knows it. And I couldn't hit the notes. I sing soprano. So I hit high notes and I couldn't. So I panicked. I was like, what is going on? Because this is water under the bridge for me. Singing it comes naturally. So he lowers the key and I still can't hit the notes. I've completely gone tone deaf. I'm thinking, what's happening? I can't, I can't hear myself. This is not right. Something is
real horror for a musician.
Yes, because this is my bread and butter. If I lose my voice, then what's my plan B, right? So just having this discussion with my colleagues, and they're like, why don't you have yourself checked out? It's a growth. There's nothing like watch and wait. It's not supposed to be there in the first place. Because your body is the way it should be. If something is abnormal, then it shouldn't be there. So just see a doctor. So we go for midterm break, and I find the referral endocrinologist at Kenyatta, and he asked me the same thing, what are you waiting for? Like, what are you waiting for? Are you waiting to collapse? Are you waiting to stop breathing completely? Are you waiting for it to become... because the previous doctor had said, if I do a surgery now, it's purely aesthetic. Good, but you don't need it. So I was like, okay. Everyone fears going under the knife. What happens in the theater? So I was like, fine. So this referred doctor was like, what are you waiting for? This should not be there in the first place when I look at it. And he goes like, a biopsy was done. I was like, yes. And it turned out benign. I was like, yes. So when he looks at my scans, he says, I can see several nodules with the growth. I can see several nodules. So from which nodule did they remove for testing? Because there are so many. Was that one representative of all the growths that you have? How did they get to know that it's the right one? So it's like the test, the benign, for it to be benign, I shouldn't have gone through that because it didn't show. That was just one part of it. What about the other 4 he could see, So it's like, this is what I recommend. Have these things removed. Can I book you in for surgery? I was like, all right, okay. So let's do this. Let's have this removed. once and for all. So I'm booked in. I know, it's a simple thing. So he explained about the thyroid and the thyroid functions, metabolism, balancing of hormones. And he said when he goes in for surgery, he will remove what needs to be removed. And if any of it is still good, he won't touch it, so that I can keep producing for myself, however little. So it won't be complete. So when we went in for surgery...
Sounds like a very confident doctor.
Yes, he was very confident. I think he's done it for a long time. So he removed the mass, which had no cancer whatsoever. So the mass was not on the thyroid. It was just in my neck, you know. That one was removed. It was really huge, almost like my palm here. And then the left thyroid had more nodules, the cysts. So he removed the left thyroid and the mass on the right. Then we were like, okay, surgery went well, you wake up, of course you're in pain. I don't like being in hospital. I have collapsing veins. So every time you put a needle, my veins sick. So you have these swellings. I was like, this is done, and I was happy about it. And he was really careful. He said he was really careful, though I lost my voice completely after the first surgery. It's like, yeah, your voice will go, but it will come back. It will come back with time. So the growth, the mass was removed, the left thyroid was removed, they went for testing, pathology. So after 2 weeks, I go back to see the doctor. The results are back, and diagnosis is papillary carcinoma. So the left thyroid was infected.
Yeah, which is a heavy word when they say carcinoma.
You know, yes. And first you go like papillary words.
I don't know why they just don't say what
you
it
have
is. They want to hit you with a
scientific names.
Terminology.
Yes. So, you know, you're reading, and you know, he's reading the report, and you're also reading it with him, because you want to also find out what is it, because it was such a long report.
Because it's happening to you.
Yes, it was such a long report. I'm like, so what does this mean? It's like, you have cancer, stage 1. So I'm like, okay, so what now? Because no one prepares you for, you have cancer. Like, you hear people saying somebody has cancer, somebody I know, but you don't expect it to happen to you. So you go like, I have what? I did cancer of the thyroid. I'm like, so what now? In fact, I was at a loss, because now I don't know what to ask next. So I have cancer. Then what? Then it's like,
Were you with anyone?
Yes, I was with my mom. The minute I went for the first surgery, she came all the way from Kitale. She was like, no, I'm coming.
Thank God for mothers.
Thank God for mothers. Yeah, where would we be without them? So I'm like, okay. So I'm like, so now what? And he was very confident. He was like, we got stage 1. This is stage 1. We will handle it.
Hakuna kitu.
This is not
But you had the cancer word.
I know.
You are lost in that one.
Yes.
Yeah.
So my question is like, so what was this mass doing in my neck? If it has nothing, why did it grow? It's like sometimes you can't explain why you're having a defect, because he just said it's like a defect, but it didn't have any cancerous cells. So he goes like, now that the left thyroid is cancerous, then your right thyroid also needs to go, because chances that it has spread all over
are very high.
So he books me in for a second surgery. I'm like, hey, okay. So you know your wound is still not healed. It's still sore. You have this long here.
You're not really speaking, are you?
No. I wasn't even picking my calls. I used to give my sister my phone. Like, I would talk to people. I would chat, because I didn't have a voice. I lost my voice. So after those 2 weeks when I went for the results, I was actually supposed to report back to work after the surgery. So now I go back, I tell my employer, sorry, I'm going in for another surgery. I work for good people. They're like, you do have it taken care of.
Yeah.
Yeah.
Me too. I had cancer too. I work for good people.
And you work for good people. It's amazing, really, when you have a good employer, because now you're thinking, you have your babies there, you have this here, you have that there. And that time your insurance has already told you, we have done our sublimit of 250K. That was the first surgery. So you're going in for another one, which is the same amount. And you're thinking, my insurance is not covering this one. you know. But you know, at that time you're confident. You're like, I have savings. You have family here, you know. So you gather. Then you go in now for your second surgery, paying from the pocket like 250. Let's go pay for this one. So we go for the second surgery, and the right thyroid that had not been removed was worse than the one that had been removed. It had more cells, like you could see the two white things, because the good thing with the doctor I was working with, he would show you what he has removed.
Oh, wow. So it's really good at you.
Yes, yeah. He would show you, and he would take photos of it and send to your phone. Like, this is what you have. This is what I mean when I say you have these growths and there's this and all that, you know. So I was like that. I was like, all right. So after the second surgery, my voice worse than the first time. So it's completely not there. So right now we are in March in Aisha, going into April. And he now books me to see an oncologist. He was like, you have levothyroxine, now put immediately on levothyroxine, which is a supplement for thyroxine. And then he sends me to an oncologist. He's like, I will see you when the oncologist is done with you.
Yeah, I always ask people this question, especially people who have now been diagnosed with cancer.
Yeah.
Did you know what an oncologist was?
I knew because my dad suffered cancer.
But if, you know, most people...
If not, I will not know those terms. You know, we say, nimeenda kuona daktari wa macho.
Yeah.
Nimeenda kuona daktari.
Because things are thrown at you now that, you know, you have to now to find out this.
What is it?
It's called oncology.
And then they're using all these names, you know. So that's when we're like, okay. So I was booked in to see an oncologist. And now he gave me now the procedure. He looked at my file. It's like, you will need radioiodine active therapy, which I kept confusing, and everyone kept confusing for radiotherapy. And he would say, it is not radiotherapy.
Yeah, it sounds that way.
It is radioactive iodine.
So what is
therapy.
it? Just break it down in simple terms.
Radioactive iodine therapy is a medication given to treat cancer of the thyroid. It's either comes in the form of a capsule or an injection that you swallow. So it's specifically meant to kill all the cells. So the milligrams are high, like what he said, the prescription is high. So you need to be in isolation because the radiation affects the people around you. So you have to go into isolation for enough days.
Definitely.
Yeah, and then when you get home, whatever toilets and bathrooms you're using, others should not use for at least 10 days, because anything that comes out of you, your plates, what you're using, your sweat, is radiation.
Wow.
Yeah. So I was like, okay. And then he says, the test, before he treats me, I need to do a body scan, an I-131. It's called I-131, iodine 131 body scan, just to see where the cancer is and has it spread to other parts of the body other than the neck and the thyroid. The test is only done at Aga Khan. So you go like, okay.
Wow.
So why only at Aga Khan? They're the only ones with the machine to do it. And they have the license to import the drug. So before the scan, there's a drug you take for 48 hours, then you go.
This scan is like a PET scan?
Yeah. It's like a PET scan. The big
probably
machine.
Uses the same PET CT
yes.
machine.
Yeah.
Yeah.
So I think the only difference is
They're the only ones who have it.
They're the only ones who have it.
Yeah.
So I needed that capsule.
Yeah.
Which
about
is
70 to get into it.
Yes.
Yeah.
So
I know.
And I was told it comes all the way from the Netherlands.
Yes.
So why can't it come in early? Apparently because it's a decaying drug, has a shelf life of, I think, 8 days or something. So for it to be effective, you know, it's ordered from out. And it's only ordered after payment. They don't just order and then you'll come for treatment. No. So the minute you pay them, then they make the order.
Yeah.
And then now I had to go off levothyroxine because I needed to be completely rid of any thyroxine hormone in my body for this to work. So I'm booked for 4 weeks after. So in the 5th week, that was in May 15th, is when I was going in for the PET scan after 5 weeks. So the problem with that is now you start feeling the side effects of not having thyroxine in your body, which is weird. I'm a very jolly person and very patient. So suddenly I have mood swings, I have depression, I'm always cold. You feel cold in your blood. You feel like your blood, something cold is going through your veins. On the outside, you're not freezing, but on the inside, your body is cold. It's completely cold. And you're always tired. You're always sleeping. Just walking from here to there, you come back, you sleep the whole day. So this is weird. It's completely weird. Then you wake up one day and you have muscle twitches. You look at your hand is shaking, and you're not shaking it, but your hand is shaking. It's scary. You have no control. Like, am I again losing my muscle strength? What's going on? There's a lot going on in your mind because you're thinking, this doesn't make a lot of sense. So by week 5, when I was doing that test, I was like, yay, finally, it's here. Let's do this. So I go, I get my medicine. I stay for 48 hours. On a Friday, I go for the scan. It takes so long. I was in there for 1.5 hours.
Oh, that's a long time.
That's a long time because I went in at 7:30.
Yeah. And mentally disturbing.
I was out. After that, I started fearing closed space.
I know.
I've never had a problem with
I keep telling you, I have
claustrophobia.
seen people scream when they are put in those machines.
And then the machine...
And it's not a painful
It's not. You're just
affair.
lying there.
It's just
it's
a moment of, I think, of reflection.
Of reflection.
And realization that you could go.
Yeah. And then the most difficult thing is for you to stay still.
Yes.
And don't move.
And to follow the instructions.
Oh, yes. Don't move.
And it's
don't
cold.
turn your neck. Make sure your neck is... And then there's that one that comes all the way close that you could feel as though it's going to touch, on your face, and you can't move. It's not a nice...
Yeah, it's not a good mental experience.
It's not a good mental experience.
Yes.
I was in there for 1.5 hours, so results come out after 2 working days. So I get my results, I go back to my oncologist. Like, these are the results, this is what is out. And it was like, yay, it has not metastasized.
Yeah.
I'm still getting used to these terms.
Metastasized.
I was like layman language. It has not spread.
Yes.
It is just in your throat.
Yeah.
It has not spread from your throat. The cancer cells are just in your throat.
News.
I was like, God is good. Yeah. I was like, this is really good news.
So when were you told this?
I was told this a week ago.
Oh, that's wonderful.
A week
so now
or so
what?
ago.
What's the prognosis going forward?
So prognosis going forward, he gave me now, he was able to tabulate the amount of it in active. That thing.
That you require?
That I require. Same thing, you need to pay for it to come in and for it to be prepared. So before we went all this, we were like, we can't get this anywhere. Because when he said Nairobi Hospital, I was like, isn't it expensive? Can't I do this at Kenyatta? You start thinking, where can you afford?
Definitely.
Considering now your insurance is not with you. You're not even looking at it. That's when you go like, let's do NHIF. You apply for NHIF and see what can you get. It throws you off. So the hospital is like, you need to pay 300,000. Then we make the order for the medicine. So I apply NHIF, hoping to get at least half. So NHIF doesn't come through. So that was the dilemma. Then my friends were like, "Ay, hapana, tunatafuta usaidizi." So my friends came together and put up a fund drive and sent out posters. My colleagues came together, guys, we are doing this. So they rallied. They've really stood by me, Because I was thinking, where am I getting?
It's always good in moments like this to then find out who.
Yes.
Yeah. Some people you think were friends and they disappear, but some you did not think that they valued you. They come on board like.
And they come on board like
before.
so fast. I'm still in shock because people I went to school with in primary school reached out. I haven't spoken to them in years. You're like, what? This thing went, and it humbles you.
It does.
That anyone would go out of their way to support you. Because times are hard.
Yeah.
with Corona, you've lost your business, you're on half pay. It's hard. But, you find people rallying together like, we will beat this. And there's always that kind of thing where you go like, how am I going to start asking people for help? There's always that fear of speaking out. And you want to carry everything by yourself. Like, I want to do this. You feel disturbing people, you're not being fair to them. They have their own problems. They have their own things to do. So my friends really came through. They're like, no, we are going to ask. What we get, we will use. So they rallied together. My employer came through for me, my colleagues, amazing people. I work with amazing people. My best friend, Marcy, and she's the one who's saying, I'm going to ask for this money whether you like it or not. And then I have friends who are like, we are making this poster, tuma picha. We need to do this. So they came in, they stood in for me. As in,
wonderful support from people.
I have gotten wonderful support from people. I have had friends coming to with shopping of food so that I don't have to worry what my children are eating, so that everything is there. I don't have to, think.
I want to ask you how they took that, but let me take a break. And then when we come back, let's talk about that psychosocial support.
Yeah.
And how necessary it is.
Yes.
We are talking to BONA WATAKA. We'll be right back after this message. Don't go away.